Okay. I'm going to call to order the Eureka Springs Hospital Commission meeting on August the 15th, 2022 at 6 o'clock. I am Barbara Dix, the chair, and roll call, please.
Kent Turner, Treasurer, Vice Chair.
Carlisle, Commissioner.
Kate Dreyer, Commissioner.
Angie Shaw, CEO.
Sharon Remus, Commission.
Judy Giggy, Secretary.
Okay, we have a quorum. I'd like a motion to approve the minutes from July the 18th.
So moved.
Second.
Okay, are there any additions or corrections? If not, all in favor signify by saying aye.
Aye.
Any opposed? The minutes are approved. Now, motion to approve agenda as written.
Madam Chairman,
Yes.
I'd like to add one item to the agenda tonight. We can add it after the engineering firm, if that would be all right, and that is about intending to file an application with the Historic District Commission for the deconstruction of the Purple Building.
Okay. Do I have a second? Okay, all in favor signify by saying aye.
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 Okay, the agenda is approved as amended. Public comments. I don't see any public, so we'll go right on to committee reports. Kent Turner is our only standing committee at this time for treasurer.
Just quickly, we still have we're still having our weekly finance meetings, which I think are going very well. We've had some more communication with potential audit firms, which you'll hear more about later, but otherwise I think things are going well.
Okay, thank you for that. Angie, CEO report.
All right. Handed out a copy to everybody, correct?
Yes,
Okay.
I mean, I have a copy.
Okay, we'll start at the top, just going over COVID-19 and vaccinations. Testing in July, we had 278 tests with 54 positive cases. That ended up being a 19.4% positivity rate for our area. So far, for August, we're at 114 tests with 21 positives, so right now we're sitting at an 18% rate. We have seen a decrease in testing over this past week, so hopefully that is an indicator that COVID is calming down again. We did have a COVID vaccine clinic at the school for school staff on Friday. It went well. They are planning to do one here in the future for children as well. I'll update you that once we have some dates set in stone. Clinical services, nursing administration, all of our ER nurses have completed trauma certification. That last class was held in July, so that has us all up to date. Nursing is continuing to advertise for clinical staff to fill open positions. We still need RNs and LPNs. Speech therapy has expanded its outpatient services to include home therapy visits, and that has been going very well. She's already had several patients, along with increasing outpatients that come to the hospital for those services. We have hired some new team members for our clinical areas in nursing, radiology, and dietary. Our employee of the month for July was our radiology director, Amy Brandt. And the ER, year to date from January 1 to July 31st, we've had 1,979 visits so far. This is a 12% increase compared to the same reporting period in 2021. And I looked pre-COVID, and we're actually up 20% from 2019. The business office clinic, we are currently working on reopening the clinic. Dr. Embry has joined our clinic team and is currently completing his orientation and training at this time. We also hired a new office manager for the clinic, and she was hired today, so she will begin the onboard processing this week. And once they've gone through training, we'll have a more firm date of when that will open. The Health Information Management Department, the coders have been working to catch up coding and getting bills sent out timely. They went from 60 days down to 10 days post-discharge of sending out those bills. And their goal currently is to get down to 4 to 7 days, so they are doing very well. Maintenance, over the last week, they have been implementing the UV system that we got approved earlier in the summer. It has been put up in all the patient rooms, the public spaces, as well as they have trained on the UV robot that we can move around the hospital when we need an area disinfected that's not covered by the installed UV systems. The clinic basement space remodel, that it has been completed. They have completed the 2 sleep rooms along with the restroom in that area. They have moved on to the outside area, putting in a new walkway. So they're doing the cement work, or will be starting the cement work for that. IT is currently working on updating servers and incorporating our overhead speakers into our emergency alert phone call system. We actually realized that all of our in-house emergency calls are channeled through our phones, to our loudspeakers on our phones, and there are certain areas that we don't have a phone where that's set up. So they're looking at putting those phones into our current system that we have. So that would bring overhead into the hallways as well as cafeteria. That way it can be heard throughout the hospital. And then I'll report that the Mid-South Critical Access Hospital Conference is this week. That is being held in Nashville, Tennessee. Jody and I will be representing Eureka Springs Hospital at that conference. It brings critical access hospitals from 5 states together to network, learn of new rules and regulations that may affect us. And so I'm actually looking quite forward to that. We will leave tomorrow and we will be back late Friday. I did attach the marketing report from Samantha on there. There are just a few things that I was going to bring up. And that is, she was able to attend a program through the community center called Fun Friday program for kids age 5 to 13. During that day she was there, she read to them our stroke education called Grandpa's Crooked Smile. And these children were able to, by the end of her presentation, were able to identify the signs and symptoms of a stroke, which I found very, very encouraging. They were very involved with learning, and I've heard back from some parents and grandparents when we do this that that's all they talk about is getting that education, and they take it home, and that's what we want to hear. We were also able, when we held the vaccine clinic on Friday, we donated stroke education school supplies, so pens, pencils, lanyards, different things like that, that the teachers will be able to hand out and kind of help with some of the school supplies there. And then just a few upcoming events that we're going to be in the community and supporting. Imagination Library is having an event at the Gotta Hold Brewery, and that's Thursday, August 18th, and then again on Thursday, August 25th, and we will be there to support during those time period. We also will have a booth at the Carroll County Fair from August 24th to the 27th, just to bring education regarding our hospital and stroke and trauma services that we offer. We are also sponsoring a hole at the Eureka Springs High School Rotary Interact Club's golf tournament on Monday, August 29th. And then we will be helping sponsor the Carroll County Hometown Health Coalition Safety Baby Shower on Tuesday, September 27th.
Okay, Angie,
Anything
is
else?
there any questions for Angie? Ken?
Yes. The only thing I would like to say is I'm glad the clinic's reopening. I would suggest that we call our reporter friend back in Harrison and let him know to see if he wants to come over and do as much as he did for us closing it as when we were opening, because I think
Yes.
that would be an excellent thing to have done.
That is actually a good idea. You are correct.
No, he was from Harrison.
Oh, sorry. Okay, if that's all, we will go on to the CFO report. Bill?
All right. Can y'all hear me?
Yes?
Very good. Let's look at our bank balances as of the end of July compared to that of June. And you'll note that they've remained very stable, a slight increase of 53,000, 1.6%. And I will add to the coding and billing update that Angie gave in that to date, so far in August, we've collected $510,000. That's $51,000 a day average, and I'm just blown away. So our cash position is at $3.51 million today, but this is payroll week, so we can gloat till tomorrow. And then, but so I'm really pleased with the collections to date so far this month. Let's look at our revenue for the month of July comparative to the other months in the year. You will note that at $1.658 million, that is the highest month there. And if you look at all of last year, that's the highest of the 19-month period. So had a very good revenue month, and you'll see the results of that here in a moment. So we're 11.5% ahead of last month and 15.5% ahead of last year. Looking on the next page at our income statement, I want to point out the first item I noticed, $9.1 million. That's, let's see, 9125. Let me get on the calculator right quick. That's an average of $1.3 million a month of gross revenue, and last year, $7.621 million. That's a $1.5 million increase, a 20% increase over last year. So our revenue is definitely trending in the right direction. We did some rate increases this last month. They were not across the board, they were selective. So if you hear about that from someone, oh, they raised rates, well, we hadn't had a rate increase in years. So it was a good thing, and it was not, like I said, it was not across the board, it was selective. Our net revenue, $5.3 million compared to $3.3 million last year. And then we look down at our expenses, and we're roughly $500,000 ahead of last year, but we have an operating margin of $377,000. And when we add in our other non-operating revenue and expense, we bring that up to $404,000 year to date, and the month was positive at $26,000. So pleased with that, and so that's trending in the right direction. Roger's doing a very good job, I think, of giving us a very good accrual basis set of financials, and so that is ever important for us to know where we stand at any given time. Turning to the balance sheet, just a couple of items there. You'll note the cash position on the accrual basis at the end of the month comparative, very similar, just a $24,000 increase there. And that's the variance in the outstanding checks from one month to the next. Patient accounts receivable, allowances, and then our cost report settlement at $157,000. That's consistent with what I came up with when I did my June interim cost report. So we're on target there. And the only other item, our accounts payable was up as of the end of July compared to that of June, and that's primarily a timing difference. the month ends and we pay Thursday, Friday of the week, and if the month ends on Monday or Tuesday, then it's before we make our payments. So not really concerned about that. And that's basically it. Pretty good month. Things seem to be headed in the right direction, and like I said, we're slightly underpaid, not tremendously underpaid, and so I'm pleased with that. And from Medicare and Medicaid on our cost report settlement is what I mean by that. So
When
go
you,
ahead and
when you mentioned a rate increase, rate of what?
what we charge for our services.
Gotcha.
Our book of business is large for the number of items that we bill out. And then it's also large for the items we don't bill out, like Kleenex and, different things like that. Band-Aids, that no longer is the case. So, but we had not had a rate increase, I know, since I started. So that goes back prior to 2019, I'm sure. So that's 3 years.
Thank
So
you.
It was time.
Okay, Bill, any more questions for Bill? Thank you for all you do.
Yes, ma'am. Thank you for having me.
No.
Thank you, sir.
Okay, the next, I need a motion to approve the med staff minutes from July 2022.
So moved.
Second.
Are there any questions? All in favor signify by saying aye.
Aye.
Any opposed? Motion passes. Okay, the next agenda item is audit firm for the hospital. Kent.
Madam Chairman, I make a motion that we go out for bid for an audit firm to audit the year 2021, and to, in fact, have that audit firm carry us for a 5-year period, so that we can tie up the audits for a 5-year period. We've been talking to several firms, and it's now time for us to go out for bid.
Okay. Is there a second?
I'll second it.
Okay. Any discussion? Okay. All in favor of the motion signify by saying aye.
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 Any opposed? Motion passes. Okay, now we have an added item, 9A, motion to go to the HDC for application.
Madam Chairman, I would make a motion that we submit an application to the HDC for deconstruction of the Purple Building in anticipation of our renovation work that we will have going on in the future.
I second it.
And a second. Is there any discussion? Okay, all in favor signify by saying aye.
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 Any opposed? That motion passes. Our next item is engineering firm, Mike Dreyer, and he is not here.
And we're going to have a kind of a problem. We discussed this at our workshop, which you weren't at. He was supposed to check with the architect to see if the architect had data ready for us to go to a bid process for the engineering work based upon the current drawings. That won't get stale. There's no reason why we can't. I'll make a motion that we go out for bid for the engineering work based upon our current drawings when they are available and ready, and the data is ready from the architect.
Okay, is there a second?
Second motion.
Okay. Is there any discussion?
Just adding the fact that it's not, what this will allow us to do, it'll give us plenty of time to do even if it's not ready, it'll give us plenty of time to write the RFP, the request for proposals, get it in good order, and then get it sent out. So it doesn't bother me that he may not be ready, because it's going to take a little bit of work to get the RFP ready to go. So.
Okay, so we'll just be ready to go when it's time. All right, all in favor signify by saying aye.
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 Any opposed? Motion passes. Okay, commission comments. Anybody? Kent?
I'll make a comment that I, by chance, had to make use of our emergency room within the last couple of weeks, and I will tell you, I was really glad that it was only about 7 minutes from my house as opposed to 70 minutes from my house, because I was in quite a little bit of pain, and it was nice to be able to get to the hospital with a short drive, and I received excellent care. So my gratitude to all of the people working that night. So.
That's great. David?
Well, I'll add a comment. I also had occasion to use the services at the emergency room. It was a minor problem, but it was taken care of. It was attended to properly, and the people were helpful and supportive and seemingly competent.
Well, that's great coming from a doctor. Thank you. Katie?
Please give my kudos to the coding department.
Yes. They're doing an amazing job.
Hear, hear.
Miracles.
Sharon?
No comment. I didn't go to the emergency.
Do what?
No comment. I didn't go to the emergency.
It's good. The revenue should be really up next month.
It's your turn.
I have no comment, and I try to stay away from emergency rooms.
So do I.
Okay, thank you. My comment is I am so proud of our commission and the hospital. Our hospital staff with Angie's leadership is doing an outstanding job. They all work together as a team and a family, and the more I'm around them, the more I appreciate them and you, Angie. So our next workshop meeting will be at noon on Saturday, September the 3rd. I bet that's Labor Day weekend, isn't it?
Yes.
But that's our workshop setup, so. And then our next regular meeting will be at 6 p.m. on Monday, September the 19th, here at the Odd. So with that, I would take a motion to adjourn.
So moved.
Second?
All in favor, I bet.
Aye.
Thank you. Thank you, guys.
Thank y'all.